And welcome back. Well, when it comes to diagnosing and treating problems, snoring and sleep apnea, our next guest says the current healthcare system is coming up short, often leaving patients with ineffective treatments and frustration.
Dr. Madan Kandula is from ADVENT. He's here to explain why and tell us what actually works for people who have these problems. And a lot of people have these problems.
Right.
Yeah, really
and it
common.
affects not just their ability and their partner's ability to get a good night's sleep, but it actually can affect relationships.
Absolutely. Yeah, it's the whole house that's infected. And it's a big deal for the person, big deal for the family. And the frustrating part is the solutions that are out there that are commonly known about, they just don't work for most people. And so there are solutions that work, and it's just a matter of trying to figure out how to get somebody to the right source.
Well, interesting too that you say that the healthcare system really is broke when it comes to not only diagnosing but also treating snoring and sleep apnea problems.
Yeah, I mean, to me, I'd say if we're doing something that fails more often than it works, it needs to be fixed.
Yeah.
And the sad truth is that doesn't have to be the way it is. The way it is doesn't work. The way it can be does work, and we see it every day. And we see the frustration on the flip side. We see lots of patients who've gone elsewhere and kind of try to do the right thing, and it doesn't work. And it's very obvious why it doesn't work, and it's just trying to flip that around.
Well, we'll get specific because I think a lot of people are familiar with some of the treatments and ways of diagnosis. So those are what, a sleep test?
Yeah, a sleep study. So a simple thing to do.
Machine.
Somebody has snoring and we're wondering if they have sleep apnea, we do a sleep study. The traditional sleep study is in a sleep lab, and that's the way it was done for decades. Now we don't have to do that. You can do a home sleep study. So that is a barrier for a lot of folks who have snoring or think they have sleep apnea. They say, I don't want to do this sleep study. It sounds daunting. A home sleep study is in your own bed. It's a little device that sits on your forehead. It's very simple, very easy, gets us the information. So that right there lowers the barrier to say, okay, well, that's not so bad. Maybe we can do that. And it's very doable.
Why do you think it is? Because I don't know if it's considered the gold standard as it relates to treatment, but the CPAP machine, the mask that people wear at night, people think if I have sleep apnea, then I'm going to be wearing a mask every night.
Yep.
But why do you think it is, though, that traditional programs, or most programs, that's really the only solution that they offer?
I mean, that's the only option they offer. So the obvious sort of deal there is if you come in with any issue, snoring or sleep apnea, the CPAP machine is going to be the only option that's offered. And the sad truth there is the machine is good. It's something that's very helpful for a lot of folks. A lot of folks find frustration with it. The most common reason most folks can't use a CPAP machine is if their nose doesn't work. And if nobody looks to see if somebody's nose works before you put the machine on them, what's going to happen? They're not going to like it. And so it gets a bad rap, and you'll see plenty of sort of information around saying, boy, CPAPs don't work. And we'll say the same thing. CPAPs don't work unless we line somebody else for success. And if you do that, they can work. And it's not the only option, but it's a great option for many people. If you line somebody up for failure, it's going to fail. And they're going to say, this machine doesn't work, this whole system doesn't work. And they're right, in that approach.
Well, and sometimes, as you mentioned, they use it for just snoring and not just sleep apnea. Is it even an appropriate treatment for just snoring?
No, it really isn't. I mean, it's overkill for somebody who snores. And same thing, if that's the only option, we'll give it a shot, but that's not the truth. The truth is there are many options for folks who snore and many options for people who have sleep apnea. And the machine is certainly one option. The other options that are there's an oral appliance, which is like a retainer that you can wear when you sleep in your night. That's pretty mellow. A lot of folks are good candidates for that. And there are procedures we can do in the office or in surgery sometimes to either stiffen up the back of the throat or open the airway up. And again, not everybody's a good candidate for that, but if you are a good candidate, wouldn't it be nice to hear that out of the gate versus being frustrated for months and years?
And then you wouldn't have to wear the machine all the time, which can be frustrating for people.
Absolutely.
So you said a few minutes ago when the nose doesn't work, and we're talking about probably a nasal blockage of some type. So are there some simple and very effective treatments that you can do? First of all, you can determine whether or not there's an anatomical issue, and then what can you do to treat it?
I mean, basically, most people who have sleep apnea, most people who snore, their nose doesn't work. Now, that's not where the sound comes from. The sound comes from the back of the throat. But if we don't identify and correct the nose issue, we're going to fail down the line. And the simple way to look and figure it out is we'll look. And so, we look at the nose, we evaluate, we see, is that our friend or is it our enemy? If it's our friend, we're going to work with it. If it's our enemy, we're going to flip it around. And they're very simple in-office procedures we can do that are, things things that somebody can get back to work the next day kind of things that are good answers for a lot of folks who have these issues, we tend to lead in that direction so we can finish with something that works coming after the throat, whether it's a CPAP machine, an appliance, or surgery, if that's a good approach for somebody.
Do people have to have had the sleep study prior to seeing you, or do you help diagnose people with snoring or sleep apnea issues?
Yeah, either. If somebody's had a study, we're happy to look at it. If somebody hasn't had a sleep study, we can do a home sleep study or an at-lab sleep study if that's appropriate. But we want that information to know, because a lot of folks, not everybody, most folks who snore don't have sleep apnea.
Yeah.
Everybody who has sleep apnea pretty much snores. So it's trying to tease out, and for us, it's just trying to get the information on the front end. What are we dealing with? What is somebody, what are their issues? Some folks, may have issues that the CPAP machine is absolutely the right fit for them, but there are folks who are claustrophobic, there are folks who have other things in play, and we understand that. And so it's not just sort of this is one size fits all, it's one size fits one, and it's a custom built approach.
I like that.
It's wonderful that you have these public sessions where people, can ask questions, meet doctors, get some of those things figured out. It's free public programming on snoring and CPAP mask problems. There are 2 dates, February 21st and the 23rd, including private one-on-one meetings with the physicians and members of the audience if you're able to attend. So the first one, February 21st, 6 p.m. at ADVENT's Wauwatosa location, and then on February 23rd at 6 p.m. is the ADVENT-Mequon location, which is on North Port Washington Road. You can register online by going to ADVENT.md/event-form, or you can call to register. The phone number is there. It's 414-771-6780. Great to see you.
Great to be here. Thank you very much.